Welcome to the Turd Nerds podcast. You are tuning in to the Functional Gastroenterology podcast with hosts Dr. Alana Gurevich, Dr. Ami Kapadia, and Dr. Rebecca Sand. Let us tell you quickly who we are. I am Dr. Rebecca Sand, a naturopathic physician, acupuncturist, and educator based in Portland, Oregon. My practice specializes in the microbiome, hormone conditions, and conditions of the gut-brain axis.
I'm Dr. Ami Kapadia. I'm a medical doctor trained in family medicine and holistic medicine with a special interest in digestive health, the microbiome, and its effects on our overall health.
And I am Dr. Alana Gurevich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, irritable bowel syndrome, and other functional GI disorders.
Okay, let's take the plunge into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
All right, everyone. So you have heard our other episodes on drugs that are prokinetics. Today we're going to transition into herbs.
Herbs don't do anything. They don't work.
Herbs don't work at all. So bye.
Yeah. Very fast episode.
So what I know here, I'll just share a little bit because our lovely Dr. Alana Gurevich is going to add in and we'll just kind of have a conversation based on this one because we have so much to contribute. But some of our herbs, especially like ginger and iberogast, don't they have data on being muscarinic receptor agonists? Mm-hmm. And then, we have a lot of formulas, artichoke and all sorts of things. Mm-hmm. I would say I use ginger as one of the main ones.
This is very well timed because
Are you going to tell your story about the ginger tea?
Oh, I have so many.
I feel like you've told it before.
Which story is it? No, I'm ready to tell it. Which one is it? I have a lot of stories.
You like to keep frozen ginger. Then you make this thing for the liver cheese stagnation.
Is this a recipe?
Ish. Okay. I mean, it's not as good a recipe
like
as my
water.
vegan cheesecake.
I don't do recipes, but I'm intrigued.
It involves hot water, which I think you can make.
That I can do.
Yeah.
That I can do. I'm ready.
And I'm sure you can ask your person. Go make me my ginger decoction.
That's fair.
Okay, so I literally was just doing a data search on the data of artichoke and ginger.
Yeah.
So that one is one that I've only recently started using. I want to start with all of these actually have data out there. There's data for functional dyspepsia on them. There's data for reflux on them. There's data for bloating. There's data for gas. Yeah. And they know somewhat the mechanism of action, but most of the data on the herbs are for symptomatic management, which in my experience is super important because A, they have very low toxicity. Like in this whole conversation, I'm never going to talk about QT intervals. Right. I'm never going to talk about dyskinesias. You know what I mean? Like they're culinary herbs.
Yep.
But they've looked at them and they actually show with a large data set really good efficacy. Let's just start with ginger.
Okay.
Right. So your list is ginger, artichoke, and iberogast, also known as STW5 in the literature.
Yeah. Well, dandelion. We've got our the cool thing about some of our laxatives, like herbal laxatives, they actually draw water in, not just magnesium, but things like the bulk forming, and that stimulates the colon to contract and move things through. So from like a muscular action, they work. Peppermint, is that included in there?
Peppermint's
Triphala?
Triphala is one of my favorite.
Yeah.
Triphala?
I think it's triphala.
It's 3 herbs.
Yeah,
right?
3 herbs.
Hence the tri.
Everything very, very, very potent in Ayurvedic medicine.
Yeah, it's awesome.
Yeah.
I haven't seen our main companies do much when I've prescribed it for patients, but you've had some success with it?
Yeah, I have had good success with it. I will say that when you use it outside of its capsule form, it is not the best tasting thing you've ever seen.
But I've heard that, some people debate that you need to taste it for it to have the real effects.
If it's like a bitter herb type of a concoction.
I have seen efficacy with the capsules.
Okay, good.
Yeah.
Okay, so why don't we start with ginger?
Okay.
6 ginger. So when you're looking at the data for ginger, nobody ever wants to study just ginger because they need something they need to patent. So you're always looking at the 6 gingerol pathways. Yeah. And the higher the 6 gingerol, the higher the efficacy. It seems to be a prokinetic. It seems to work on the small bowel and the large bowel. Dr. Kapadia was telling the story that I just remembered. Hack right now. Here's something that's going to change the rest of your life.
Wow, I'm so ready.
You should be ready.
Wow. I'm not sure if it's going to change your life.
It's going to change your life. So you can buy ginger and put it in the freezer so it freezes, right? So it's always frozen. And then when you need it, you take a little microplaner and you just grate it, skin and all. You will always have fresh ginger on hand.
Oh, yeah, I do that.
game changer. And you don't even.
No, it was a game
Do you
changer.
eat the skin?
Fairness.
Do you eat
Yeah,
the skin?
yeah.
Yeah, you can if it's frozen, it gets thinner. Or
Yeah.
something for some reason.
And you can just
okay.
microplane
That
it.
might change my life then.
or just grate it.
Yeah. No, microplaning is grating. It's just
Isn't
grating
it
with
the
very
tiny-
small.
Yeah, I don't
It's
have
very-
time for that.
yeah.
Again,
Oh.
yeah.
Huh.
I'm like in and out.
Yeah, no.
I got stuff to do.
But it is very effective. And so whenever anything is going on with my kids or my patients, what I'll have them do is make a very, very strong herbal decoction. So ginger is a root. So whenever we're preparing a decoction, what that means is you need to have a rapid boil for a long amount of time. Leaves you steep or infuse, roots you decoct.
Yep.
So one of my girlfriends was just complaining to me
With a lid on.
with a lid on.
Do what with the lid on?
Steep it. Like,
Okay.
oh no, boil it. Boil it with a
Pay
lid on.
attention, Dr. Kabadia.
You're talking about the leaves or the decoction?
Decoction.
Okay.
Herbs.
Roots.
Okay.
Yeah, roots.
I mean, anything aromatic you want a lid on, but
Yeah.
Okay. Boil
So-
with the lid on.
For
With a
aggressive boil.
Slow aggressive boil.
I would say aggressive boil.
Okay.
wanna
And it
tear
doesn't
those
boil
roots
over? Okay.
Well, no. I mean, you're watching
Okay.
it.
Okay.
So one of my girlfriends was like, I need.
I need very specific detail.
we need to monitor you in the kitchen, I think. Not me though. I've already.
She's grown so much as a cook
It's
though
true,
in
it's
like
true.
this short amount of
Yeah,
time.
it's true.
Yeah,
You
amazing,
need to
amazing.
monitor her less.
Okay. Okay.
And she's also very inspired to get new recipes.
It's true.
Yeah, I think she's in it.
See, I'm not. You've beat me there. Anyway, back to ginger.
Okay, so one of my girlfriends reaches out to me and she's like, I need a consult, and I was like, okay. And she's like, I woke up with basically the equivalent of terrible food stagnation. I feel like I have a rock
I think
of
you
lead.
mentioned this.
This just happened this week. I'm sure it's happened before,
Right.
but this just happened this
Yeah,
week.
Wow.
I have a rock in my abdomen. I feel like I'm never hungry. It's been happening for weeks, and I was like, why did it take you 3 weeks to talk to me? Like, this is literally what I do for a living.
Yeah.
And so I was like, okay, here's what you want to do. Take like an inch of ginger, chop it up, put it in a pot, fill it up, probably like 8 cups of water, bring it to a boil and let it boil
Only
for 30
1
minutes.
inch of ginger?
You chopped up.
Chopped up. Okay.
Yeah. 1.5 chopped
Yeah.
up. And let it for 30 minutes, and then that's your tea that you're going to be drinking. And she was like, ooh, that was spicy.
Yeah.
That
Totally.
it's very spicy, but it works on all of those smooth muscle receptors
Yep.
in the small bowel to help things move.
Do you just slice it like slices?
I keep mine in the freezer, so
right,
I
right.
would grate.
Oh, you grate it even for this purpose.
You can slice it though from the freezer.
Yeah.
You want a
Okay.
sharp knife.
Okay.
Yeah, and some upper arm strength.
And 8 cups of water?
but
8
not
cups
us
of water.
here.
And you had her drink that whole thing?
Over the day. She's just
Okay.
sipping on it. We're just trying to move that
Yeah,
smooth
yeah,
muscle
yeah.
to get it to
Right.
to be less stagnant. In
Awesome.
Chinese medicine, this is what we do. And she was like, well, I cut it with a little lemon and honey.
Nice.
And I was like, be careful because you don't want it to be too sweet.
Yeah.
That spice is the activity that's moving that smooth
Yeah.
muscle. From a Chinese medicine perspective, that honey is going to like dampen
Stops
things
it up, right?
Yeah.
What if you do a little peppermint leaves in it?
So let's talk about peppermint separately. I think it would help though. Peppermint definitely helps things descend down.
Yeah.
Yeah.
Peppermint relaxes the smooth muscle also,
Yep.
but especially of the sphincters.
Yeah, it's analgesic.
And it's analgesic.
Yeah.
But if you have reflux, it's not going to
Carminative.
be good for everybody.
You
Ginger
know,
is
yeah,
one of
not
the
for
key-
everybody. Some people it helps.
Ingredients in the chai spice blend mix.
It is the key ingredient, right?
Yeah, I would say.
What's your chai spice mix, Dr. Kapadia?
It's ginger, black pepper, cinnamon, clove, cardamom. You've got to adjust the black pepper.
I made
Dr.
that
Gurevich
mistake.
can't handle a lot of black pepper,
I-
but other
Oh,
people
yeah.
can.
I'm
Like
Jewish, guys. Yeah.
I don't
just
really
Auntie
like
likes a lot of black pepper. It depends
Yeah.
on which auntie's recipe you're using.
Okay,
But
got it,
Yeah,
got
I
it.
think I jumped into the most aggressive.
you
auntie's
did actually.
recipe.
You
Yeah.
did. You did. There was 3
Oh.
versions, and you jumped into the spiciest one.
Yeah, and I think that.
Auntie.
So that's ginger. There's also this fairly large ginger set. There's this fairly large data set that looked at ginger and artichoke together, and this is what I was literally
Yeah.
I was writing about this weekend, and it's using a formulation. Oh, it's going to kill me. But basically, the formulation is 100 milligrams of artichoke and 20 milligrams of gingerol. That's the formulation that they looked at. And this was a functional dyspepsia study,
Oh,
human trial that showed actually high efficacy to relieve symptoms at the 8-week mark of dyspepsia, bloating.
But not before? Or until the
They
eight-
only looked for
Oh.
trial, 8-week intervention,
Yeah.
follow-up.
Okay.
And so at the 8-week
Oh.
trial, at the 8-week point, I think they actually might have also had a 4-week point and 8-week point. And by 8 weeks, you had double the amount of efficacy that you did at 4 weeks, but good efficacy for matching those two products together.
Yeah.
And we do have multiple producers who are now marketing this brand
Yep, totally.
for bloating, for dyspepsia. So also it has pretty good efficacy.
Yep.
So I'm using that a lot. Are you guys having any experience with those?
I haven't used that one very much.
Yeah, the one product I'm thinking that's just those 2 ingredients. I like to dose it, like for all the reasons we use Herbal Prokinetics with like SIBO treatments and relapse prevention and all of that before bed to help stimulate that migrating motor complex. But I also use that ginger artichoke combo as almost like a digestive enzyme, digestive stimulant. So like maybe 10 minutes before meals. If people are having like food stagnation stuff with their meals, I've seen it really help. I dose it lower. I'll do like 1 pill.
Interesting.
And then like 2 or 3 maybe before bed for the MMC.
And so, with a lot of the ginger products that we use, because also you can just use straight ginger,
Yep.
one of the most common symptoms will be ginger burn,
Yep.
which is exactly like heartburn, but caused by ginger.
Yep.
I don't
Super
see
intense.
ginger burn with these combinations because it's such a lower
It's
dose
a lower
of ginger.
dose. And I think if we can get that extract from it instead of just straight ground ginger, that is intense. But totally, yeah.
And if you can't, and finances are an issue,
Just eat it.
Or just drink ginger tea.
Yeah,
Yep.
or you could put it on your
Yeah.
food, or
And
ginger tea is an easy way.
For me, whenever I'm looking at ginger, I'm like, okay, the 2 most traditional and like old forms of medicine, Chinese medicine and Ayurvedic medicine, ginger is a key
big one.
foundation
Totally.
for both of them.
Yeah.
Yeah.
Like that's the longest clinical trial
And
we've
it's
ever run.
analgesic.
Right.
It does so many.
And
ginger
they'll
peppermint
do
are-
sliced ginger with salt and lemon that you chew on before as a digestive stimulant
Yum.
before you start eating.
With salt and
Like
lemon.
Yeah, like just cut some, put it with salt and lemon in the fridge, and then you have like chew on that or eat a little bit of it like 10 minutes before you're going to eat or 5
Sounds
minutes
like
before
the
you're
start
going
of
to
a
eat.
cocktail.
Yeah.
Or a really good meal, apparently.
Sign me up.
Yeah, I mean,
I love ginger.
yeah, ginger. And, for me personally, who's always cold,
Oh yeah,
ginger
it heats you up.
like, I love the ginger burn when
Yeah.
I was taking ginger because
Yeah.
it'd like be the only time in my whole life I was
Yeah.
warm.
Yeah, I'm the opposite. It makes me too hot. But another
Oh.
reason to blend.
Yeah.
Add some peppermint or
Yeah,
whatever.
peppermint, because peppermint's
Totally.
cold.
I wonder though,
licorice.
in those formulations that have artichoke, because artichoke drives things down. It's a bitter and moves things down. If that helps with the ginger burn. Because I know some of our other formulations that don't have the artichoke, it's obviously, if we're referencing the same one that I learned from your brain, it's more ginger, and that one's killer for the ginger burn, but it doesn't have artichoke too, so I wonder, if there's something to that.
And for me, I'm always like I always want, if I can see human data that's like a well put together trial, that's always going to convince me to try it with patients. And there is actually good human data on this.
I mean, relative to herbal
Right.
studies in general, but low risk.
Very
kind of
low
stuff.
risk.
Yep.
Okay, so then the other one is STW5, also known as brand Ibergas.
Yep.
We're going to have a conversation about this, but I'm going to say it is getting harder and harder to get.
Yeah.
So,
Wasn't it Bayer?
so Ibergas. So basically, if you go to like Germany or Austria or anywhere like there, and you have a GI complaint,
You can still get it, right?
I think you can still get it. You can get Ibergas right off the shelf, right? It's like Ibergas is the Pepto-Bismol equivalent for Germany and Austria. And in fact, I had a patient who used to work for Boeing, and he was down there and he had a bout of traveler's diarrhea, and then he went to see a doctor and they were like, pick up Ibergas.
Wow.
And so he brought it back with him because it was so effective.
Yeah.
But Bayer Pharmaceuticals bought it
Yeah.
and then immediately pulled
Like
it from
years ago.
and immediately pulled it from the US market. Immediately. But you were still able to get it on like Amazon.
Yep.
And I think that they were importing it.
Yeah.
I'm not sure if Bayer has pulled it from all markets because now you can no longer get it on
Yeah,
Amazon.
I've heard that in like the last couple of months.
In the last couple of months. And so there's also these Canadian pharmacies that you should be able to get it from. You can't get it from them either.
What the heck?
So I don't know what's going to
I have
happen.
a bottle.
Keep it.
Yeah.
Well,
black
you
market.
you two could probably concoct it from
It's hard to. So there is a local herbal manufacturer that's owned by a naturopath, and they're actually working on making their Ibergas equivalent.
Yeah.
The problem really is that it's a proprietary
we don't know the
formula.
exact formula.
But it's got a lot of the bitters. It's got chamomile.
It's got Iber, which is the main
Yeah.
active ingredient.
Yep.
So they could probably make something similar.
Ginger, licorice. It's definitely
Yeah.
got licorice. It's very licoricey.
So right now, if you're looking at the data for STW5, this is another formulation that has a massive amount of data behind it.
Yep.
And it shows that it has efficacy as a prokinetic
Yep.
for everywhere from the small bowel all the way down. There might also be some activity in the stomach, but it's less clear. And literally, it just works on the smooth muscle to engage the activity of the migrating motor complex and also the activity of peristalsis. When we're talking about dosing STW5, We can dose it at bedtime, at like when we know you're not going to be eating anything to push the migrating motor complex, and we can also dose it before meals. And so similar to like the ginger and lemon and salt, which now is going to become the staple of my life.
Oh, I love it. I can't wait to do it.
Or the way you use the motility Prokinetics with the ginger and the artichoke.
Yep.
Like you can dose it in exactly the same way to act as a digestive stimulate.
Yeah, cool.
It's
It's bitter.
It's bitter.
Got a lot of bitters.
It's very well tolerated, and even kids will tolerate it.
Yeah.
And I do think they did a safety trial, and it has exceptional safety.
Yeah, totally. I think you have to monitor the licorice.
If they have blood pressure issues.
Because it's got quite a bit, and I mean, we don't know how much, but that's the only like caution I've heard from midwives in their use of it in like pregnancy.
Makes
but other
sense.
than that,
Yeah.
I mean, it's a blend, and blends you don't have high doses of anything.
Yeah. Right.
So,
it's not the best tasting, but it does have good efficacy and good human data.
yeah.
So that kind of brings us through the ones that I have a good data set behind it. Okay.
I have in my notes here, and it's like, are they true prokinetics or are they acting on the bowels? So other ones that I have that are kind of like laxatives, turkey rhubarb. That'll move things. Cascara, absolutely. Senna, for sure. We know what happens there.
Aloe.
Aloe. Whole leaf.
Right.
Will get you pooping.
But you don't want to use senna or aloe long term, right?
You know,
Aloe too, I
correct.
believe.
You can get atonic constipation, another subtype of constipation, or baggy rectum. It's sometimes called.
Yeah.
No.
Poor sweeties. Yeah, baggy rectum.
Even with aloe, I feel like I've read
There's
that.
strong purgatives.
Stimulant laxatives. There's a risk of that. There is a little bit of data that suggests that isn't the case, and you can use them long term, but why?
Right.
We have other things we can do.
I mean, I will just say on the why, I definitely have a subset of chronic constipation patients where that is the only way they can move their bowels. Yeah.
Are
Senna
you
and
using all the
cascara.
drugs?
So, different people have different tolerances and have different requests. As a naturopathic physician, often my people don't want the drug.
Yeah.
And Senna works.
Senna works.
The problem is I have also seen Senna work until it doesn't work.
Right.
And that's hard.
And then you're in big trouble.
And then it's hard to find anything else that will work after that's changed the bowel.
Hydrotherapy, and that does the same thing.
Don't do that.
No.
Yeah, don't do that.
Don't do it.
And then, the next possible thing is possibly bowel resection.
I know.
For a colectomy.
Atonic.
Yeah, it's very, and then you worry about like Hirschsprung's megacolon and stuff like that with these patients. Like my soapbox warning is don't start the trajectory of needing to have bowel movements using some kind of water retention or colonics.
Yep. Yeah, for sure. I try to get people off those because you get dependence, and that's really
and
awful.
it can be irreversible then. I feel like I've had patients where nothing else will work after they've done these enemas for years and years, right?
And enemas and colonics, you risk putting bacteria in the wrong place.
It just doesn't seem like a good idea to do anything like that regularly.
I mean, interestingly, just to play devil's advocate, there is a long history in both Chinese medicine and Ayurvedic medicine to use enemas for treatment.
I mean, the U.S. people used to do it
I'm also
back in the day.
There's a time and a place, but if you're relying on it,
right, as a regular daily,
opt for enema over colon hydrotherapy, things like that.
Yeah, and opt for neither if you can get
opt
neither.
For neither.
And is there a way to reverse the tonicity changes from for example, I have a specific patient that had been doing like daily enemas for years.
So that we just did 2 awesome episodes on using the pharmaceuticals.
Do you think that could it could be regenerative?
It
potentially
could be regenerative.
The one drug, right?
Yeah, I've also I mean, I've also seen it do nothing.
Right,
like
it's worth a shot if they've been doing that for years and they're willing to stop to try one of these the one drug that might have regenerative properties and everything else you can think of.
I will say I am in anybody who attended the Gastro Association of Naturopathic Physicians conference this year. There was a speaker who talked about a new strategy subset that I am starting to implore with my patients. So I might have updates for you. Like, first of all, if you have never been to that conference, you should go. And second of all, the last speaker talks about this protocol, and I immediately instituted it in like 10 patients the first week because chronic constipation is like a huge issue.
Was that protocol specifically for constipation?
Yes, constipation and chronic intractable bloating.
Okay.
Cool.
And so I'm starting to see some returns on investment.
That's great.
So I might have an update on it, but I'm not ready to say it's going to work yet.
And it was for a very specific symptom subset of constipation and bloating, not just anyone with constipation bloating.
So if it works, we will definitely do an episode on it.
We'll report back.
Okay.
And
then
then-
we've got like soothing things that can really help with this too, like slippery elm. Aloe would be in that camp as long as it's not the laxative one.
Yep.
But that can totally help.
And it's the inner leaf of aloe?
The whole leaf,
Uh-huh.
or the latex, right,
Yeah.
is the laxative form. The inner is okay.
Yeah,
right?
yeah.
And I don't think the inner has any potential issue with.
No, it's soothing.
Right.
It's great for autoimmune disease. It's great for diabetes, actually. We have cool studies on that. It's soothing for the gut, gastritis, healing. It's awesome.
Okay.
Just be sure what part you're getting.
And there's like a drink formulation that we've had people get, I feel like,
Oh,
just
yeah, you
over the
can get
counter
that.
from the
Yeah, yeah,
grocery
yeah.
store.
Mm-hmm.
And not even like the natural food
Right,
store,
just
like
at the grocery store.
Yeah.
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 And that has a very, very historic use.
I think
Totally.
I used that with a patient who had a pill esophagitis.
Oh, yeah.
And
yeah,
nothing,
yeah.
it was taking longer than normal to
Cool.
resolve.
Yeah.
And that did help.
Let's talk about Triphala.
Okay.
Triphala?
Yeah.
I do think it is a great herb.
Yeah.
I think that it is one of those things that can
Where do
really
you see it
help.
shine? Like, where are you thinking in your clinical practice? Like, let's try this one.
Let's say some of our other laxatives
Mhm.
are too strong. They're
Mhm.
causing too much diarrhea. They're causing too much effect. This is like a pretty
Mild.
laxative. Yeah.
I think of it in my adolescence.
Oh, interesting. Tell us why.
It's gentle, and I
Huh.
don't really want to put them on drugs quite yet,
Yeah.
if I can help it.
And you've used a liquid formulation that's worked?
I have them eat the powder. No, I'm just kidding. Jeez, really
'Cause-
is. I use the capsules.
Okay.
There's like a blend that has it in it that's kind of like a honey herbaceous blend. You know what I'm talking about? It's
Yeah.
like a scoop thing.
Mhm.
Okay.
That one I've tried. I don't know that I see that one work quite as well, but the capsules is probably where I go.
Right.
Yeah. And it also, if you taste it, it is very, very strong.
Yeah.
Yeah.
Totally gross.
But it is like for some people, that is like one of the most effective, gentle.
Mhm.
I don't know, you don't develop dependence from it.
Mhm.
And it's also
Totally.
a culinary thing. Not
Yeah.
that I want to eat that taste, but
How about caffeine?
Oh,
Green
yeah.
tea, coffee.
coffee for sure.
Yep.
Green
They're
tea?
stimulant laxatives. I don't know that they necessarily are prokinetics, but they do move. But they're considered stimulant laxatives.
Green tea too?
Caffeine.
Huh.
So back to the chai, you get your ginger in there, you
Oh.
got your
Yeah.
caffeine in there, some
You can-
polyphenols.
I'm sure black pepper does something.
Probably.
And also, you can throw some licorice in there.
Oh, do you do
It's
that?
not in any of the
No,
auntie
it's-
mixes, but we'd have to make a new
Oh.
category 4.
Okay. Yeah. Okay. Yeah, caffeine, green tea, I can't say I'm really using it, but we've all had our patients who stopped drinking coffee and they got constipated.
Right, and they probably just
Um,
had constipation and that was being treated for years with
Maybe,
coffee.
or, was it a dependence thing?
I mean, for sure, I think we all, first of all, have tons of patients, and second of all, tons of aunties who have been using caffeine as their laxative.
That's true.
for,
Do
like-
Russian aunties
Oh my
have
God.
a set
Yeah.
program?
Russian
What's their
aunties-
caffeine of
Oh,
choice?
coffee.
Okay.
But sometimes they like to throw in a cigarette, and that I cannot condone.
I don't
like
think that's
coffee.
prokinetic.
The
It might
cig-
be anti.
Nicotine?
The nicotine?
Oh, the nicotine.
Yeah.
Okay.
Yeah.
So
But-
just smoking a cigarette, you think
Caffeine
they're
and smoking
getting
a cigarette.
That'll do it.
nicotine to
Yep.
their gut?
Yep.
Wow,
I can
wow, wow.
remember I was on a road trip and I was so desperate. My constipation was so, because you're
Yeah,
moving.
did you smoke a cigarette?
I totally did. And you know what?
Oh, Lana.
It did not work.
Oh, boy.
It did not work.
I'm surprised that has a significant GI effect.
Significant.
Okay,
Huh.
I had no idea.
Yeah, I guess
Yeah.
I wasn't really aware either. Yeah, I will say for my patients who are like stopping caffeine or coffee, it's
Uh-huh.
specifically,
And cigarettes.
hopefully, yes, and are constipated. The first thing I use, and I think it helps, is just add digestive bitters,
Yes.
because coffee is also a bitter. And I'm wondering if you
true.
just keep one of those actions on the table, if that'll help. So,
And I'm positive that the bitters have an effect on the acetylcholine
probably.
pathway. Like that would be my
It's-
guess.
That gastrocolic reflux
Yeah.
is big. So when you put something in, especially and start that secretion, you stimulate the bowels to go. And I think bitters are at the heart of
And
it.
those you want to taste usually. So
Yeah.
you're
Oh,
doing
yes.
a liquid or a
Yep.
spray or
Yeah.
the ginger and the lemon
Yeah.
salt is a
And
bitter.
what I was taught is if you overdose on bitters, it actually stalls the digestive
Oh.
tract. So I'm cautious with my patients, like 5 drops, 10 drops max, because people will like go for it. We all have those patients that like really overdo everything.
Yeah.
Mhm.
And that can actually slow the colon.
And
Yeah.
I am playing around with like a chicory dandelion, like blends like that
Cool.
to use to replace. And it actually like in the middle of winter, like a latte that's
Oh,
not too
nice.
sweet,
Yeah.
that's made with a bunch of those culinary herbs that are bitter,
Yeah.
is very nourishing.
Yeah,
So which ones
totally.
are you
So
making?
I'm using like chicory. Chicory is
doing,
usually
like,
the
a
foundation.
tea,
I'm
not like a
using a
tincture.
tea. I'm
Got
using a
it.
tea.
Yep.
like a tea bag?
No, there's like a you can like put together these blends.
The whole herb.
Whole herb.
Okay.
Yeah.
A little
So
more labor.
ginger, dandelion, artichoke might be in there.
Okay.
Yeah.
Yeah, really, and it's like
I don't think
it's just
I
like
could
You
coffee.
buying them
that
at the
much.
tea shop? Are you buying those at the tea shop in bulk?
You can buy them at the
Is
tea
that what
shop
you're
in bulk, or you can get like these powders, like these
Okay.
coffee replacement
Oh,
powders.
yeah, yeah.
Oh,
that are
right.
chicory
Those
based.
things people.
Yeah.
Yeah, I've seen
They
people.
can be bloating though. They're fermentable.
They
fibers.
can definitely be bloating,
Yeah.
and they can make you go. So
Yeah.
that can be anti-bloating
Win-win.
Sometimes.
For some people.
for some people.
I don't do well on that chicory root.
I really
Oh,
like
yeah?
it.
Yeah, I don't know.
Yeah, I don't.
It's not a good
it's
Oh,
not
I
good for
love
me.
it. It's
Oh,
like
really?
so invigorating
Yeah.
for my digestive system and for
Yeah.
me.
My small intestine can't handle that.
Yeah, mine neither. Can't either.
But I think it's really good for you.
Yeah.
Great fiber.
And
If
then
you
it-
tolerate it.
And then it like cleans your blood from like a detoxification pathway.
That's
the bitters
true.
are really important
Yeah.
just to stimulate detox.
Yeah, I forget about teas. I usually give them like after meals.
Oh.
If people are having digestive issues, and then the tinctures or whatnot prior.
Before.
I really like gentian. It is so bitter.
Oh,
but
gentian is so good. Gentian is like,
That's my favorite.
and you know, there's this old naturopathic formulation using gentian and scutellaria
Yeah, that was
together.
our main one we used with people, right?
So good.
Yeah, it's great.
So good.
Yeah.
Does
yeah.
it, and it tastes fine.
Terrible.
No?
Really bitter.
I can't
Yeah,
remember.
gentian's rough.
Okay.
Yeah.
You want to put like peppermint or
I think it only had
orange.
gentian and scutellaria
I
in
worry
it, the
about
one we were giving
peppermint
people.
because it's so cold. Like gentian
Yeah,
is cold,
totally.
scutellaria is cold,
Yeah.
and then peppermint is
So we
Add a
cold.
put
little
some ginger in there.
Ginger, I would try.
Yeah, or orange in
You
it.
guys should make a blend.
You're right.
Yeah, no, totally. It's coming, guys. It's
The
coming.
next product.
Yeah, because we've got so much time
I
to
mean,
make a
there
product
are great
line.
ones on the market. That's how cocktails came to be, is bitters
Right.
before and after.
Oh yeah,
meals,
and
but-
then bitters. Like you can get
Yeah.
bitter, like
Right,
moonshine
and-
bitters
yeah,
from
in
the
an
liquor
alcohol
store,
Yeah.
and they're great.
And just
to
use that in like in a tea.
or you can use that in like mix it with bubbly water, so it's like
Yeah.
a bitter soda.
Mhm.
Right.
Yeah, brilliant.
And you really, with those, when you're trying to stimulate with bitters, you do not want to add too much sweetness. Like
Yeah.
you are looking for the bitter to stimulate the digestive
Yeah,
property.
yep. Train your body to
Yep.
like bitters. Dandelion is also another great one. Good fibers, good for the liver. Bitter as well. I really like to use that one
Yeah.
too.
I can remember one of my girlfriends was telling me that she was going to Mexico, and to prevent foodborne illness, she didn't know about our foodborne
Traveler's
traveler's
protocol.
Should have listened.
Should have listened. It was 10 years in the past, but
No, should have listened in the future.
she would say that she would take bitters, like a gentian scutellaria mix, before she, like right when she'd order. And she was at this restaurant in Mexico, and it was so slow, but her GI did not know that the food was going to take forever, that it started churning and
God.
squeezing.
I totally
like
had that
you
happen.
can totally
Yes.
feel everything move.
I think my belly might be doing that right now.
That was a great episode. I think
Yeah.
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 So some of the
Learned a lot
main
from you.
herbal prokinetics would be ginger, the product that we can't get as much anymore, STW5.
Yeah.
But you could make
artichoke.
a similar blend, an artichoke ginger blend, or some of the ones that are available. Or you can do like a ginger tea if you don't want to do an actual supplement. And then bitters before meals, digestive teas after meals.
I'll also say there's a liqueur made out of artichoke called Chinar.
Oh,
It's one of my
cool.
favorites.
Is it good?
Chinar soda with a twist of lemon. Yes, I love it. I really like it, but it's like a straight artichoke based bitter or amaro.
Huh.
Yeah, cool stuff.
Yeah, so basically we have a lot of drugs
Yep.
and we have a lot of herbs.
So we have a lot of herbs
And-
and a lot of ways to use herbs, which is really cool.
And let's be honest, none of us are the 3 best herbalists on the planet, and we just listed like 10 herbs. Like herbalists have even more
Yeah.
herbal blends.
Totally. And like the whole digestive tract can be impacted by this. So all the way from like the mouth and upper GI issues, small intestine, large intestine. Prokinetics are amazing.
Yeah, thank you.
Thanks for tuning in.
See you
Bye.
next time.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the turd nerd word.